Hello everyone, welcome back to our channel. I'm Dr. Mel from City Skin Clinic, and today I thought we'd talk about the world's most dangerous cosmetic procedure. And the reason for that is this is one of the most popular procedures in the world. It's something that you see a lot of on social media, but I don't think a lot of people are aware of the risks of this procedure and the things that can go wrong. And as always, this channel isn't meant to kind of disparage anything. It's not meant to criticize, but it's really meant to inform. And although in our clinic we only do non-surgical procedures, I do get asked a lot about surgical procedures because of my background as a surgeon. And this is one of the things that we get asked about, and so I think it's important to share this bit of information. I will also leave some relevant links below, and as always, if you have any questions or comments or experiences that you'd love to share with us, please leave a comment below. So before we get started, if you're new to our channel, welcome. And please don't forget to subscribe to our channel. If you're returning, then hello again, welcome back. So, what is the world's most dangerous surgical cosmetic procedure? It's actually the Brazilian butt lift, or BBL as it's also known. This is a really popular procedure, and you know what? A lot of its rise is to do with sort of just the cultural changes that we've had. So it's popularized, although Kim K has never ever, she's always denied having any sort of bottom surgery. You know, that kind of figure, that kind of shape that is popularized by the Kardashians and increasingly a number of, you know, famous artists, people like Nicki Minaj. Again, I'm not suggesting that any of these people have had any surgery or Brazilian butt lifts, but that sort of body shape has been quite popular for a few years now, for the last decade, and that has driven a demand in this procedure. And again, you know, things have only gotten really worse with social media, particularly Instagram and apps like Facetune, where people can get that idealized sort of S-shape hourglass body, and that does involve, you know, kind of this incredibly round sort of pert sticking out behind, and a really itty bitty waist, and you know, large kind of enhanced breasts as well. And so with that, the demand in obviously breast implants, but that's been going around for a while, but BBL, and that's a procedure that's 20 years old, but it's really having its heyday at the moment. And with that, we're seeing a lot of increased complications and really horrible side effects, including death. And so I thought I would just make this video about kind of just the information that we have on what this procedure is, and also what the possible risks and side effects are, and things, if you are considering it, the sort of questions you should be asking and things you should be considering. So the BBL, or Brazilian butt lift, is a procedure that was created by a Brazilian surgeon of about 20 years ago, and it involves taking fat from other parts of the body where you don't want fat, so most commonly the tummy, sometimes the thigh area, arms, could even be around here, so areas of the body where there's excess fat, and then cleaning up that fat and re-injecting it into the butt area. And so you strategically inject the fat so that you can end up correcting sort of contours, so things like hip dips, also exaggerating the curvature perhaps at the back, and maybe removing asymmetry if you can. And so that's the idea of the procedure, and it doesn't stop with the fat grafting. So what you're doing is you're taking the fat, and with that the fat cells from one part of the body, you're putting them in the other part. Not all of that fat will survive, but the fat that does survive, and by survive I mean when you move it to another place, think of it like a transplant. You're transplanting tissue from one part of the body to another, and in order for it to survive in the other part of the body, it needs to get vascularized and establish itself there. So not all of that fat that's grafted will take, but of the fat that does take and it does grow, as you it behaves like fat anywhere else in the body. So as you start to put on weight, that fat will get bigger. If you lose weight, it'll get smaller. So your kind of the new, your new bottom will also be affected by weight changes, and that's something that people need to be aware of. They also need to be aware that usually after a BBL, people are kind of encouraged to put on a bit of weight just to enhance the result of the procedure. And it was born out of like I said, shifting kind of interests and tastes, and people wanting to, the idealized kind of body has become more of a glass hour shape in popular culture. And it's also was seen as a way that was kind of nicer than silicone implants, which were the sort of main way to augment the buttock, or more extensive surgery where you're kind of trying to create that volume with more complex techniques. So this was sort of seen as a simpler way to do that, and also a lot of people, it appealed to them. With implants, we know implants can rupture, so they can burst, they may need to be replaced every number of years. So this was seen as a much better way because it involved taking something that you already have, so you know that when you put it somewhere else, your body's not going to reject it or behave badly to it. That's the theory, and it's a procedure that can take anything from 3 to 6 hours, because really it's two procedures. There's the liposuction part, and then there is the buttock augmentation part. So the procedure itself, it has to be done, and I cannot state this enough, by a qualified, trained, experienced, licensed plastic surgeon, and because this is a big operation. And it needs to be someone who has done this procedure many times, and that they're regulated. And so the procedure itself, you're under general anesthetic, so you have to be asleep for it. And then after the procedure, no one will see very much because there's a lot of bandaging in the areas where the fat was taken, because in those areas you want the space where the fat was to close up. You want to avoid having liquid collecting in that space and inflammation, so it helps with the healing. And so these are compression bandages, and they're quite tight. And then you also have bandaging around the buttocks themselves. Again, that's to help with the healing process. So like with a lot of cosmetic surgery, you won't see much of a result for several weeks afterwards, and there will be a period, a downtime of pain, of limited mobility. So that's something that it really needs to be thought of hand, and a lot of people have to take time off work to help with the recovery period as well. So again, the idea of this procedure, like all surgical procedures, it's an important procedure to kind of think about it from a medical perspective, but also unlike, like I mentioned, the title of this video is the world's most dangerous surgical procedure. And so the big reason that this procedure is so dangerous is there is a sort of relatively high risk of complications, including death. So I know that's quite shocking, because you think of a kind of a BBL sort of fun idea, and it's something that's entirely cosmetic, but there is a serious risk of death. So that's quite shocking, to be honest, for a procedure that's entirely cosmetic. And think of it, the patient selection for this procedure is quite high because it's cosmetic. So you normally go for, patients who, or should be choosing patients who are healthy, who don't have any serious medical problems, and that should normally lower the risk of the procedure. So why is this death rate so high? The big one, it's pulmonary embolism. So that what can happen is, because you're injecting these large amounts of fat into the buttocks, an area with lots of really important blood vessels, even in the most experienced hands, it's possible that a bit of that fat can basically get into a blood vessel and travel all the way to your lungs. And when that happens, it shuts off blood supply to the lungs, and you get a pulmonary embolism, which can cause death. So that is the way that this procedure can cause death, and it's something that is very. It's like I mentioned. This is even in experienced hands. This complication has happened, so it's just to do with the anatomy of that area. And if you imagine in experienced hands, you have the risk of death. There are also a whole bunch of people who perform this who are maybe not that experienced, or maybe in areas or countries that aren't that regulated, and that increases the risks. So death is obviously the most catastrophic and the worst effect, but there are other effects that can also happen that are more common than that. So things like after any procedure there's a risk of infection there, and that, you know, BBL is no kind of exception to that. You can get horrible infections, and some people can end up having sepsis where the infection gets into your bloodstream, into your system. So that's something really important to think about, and it's just even more important to think about this for people who may be tempted to go abroad and have this procedure because it's cheaper. You know, are you in a position where if something bad like that happened, can you get urgent medical help that you may need to save your life? Other things that can happen are things like the fat. So, you know, something like up to 50% of the fat may not take. So you might think that you're going to have this sort of set amount of volume in your head, but some of that fat may not take, and even something like 50% of it, which means that you know, and it's not a uniform, so you can't control which bits of fat take and which don't. So what that may mean is, you know, let's say in a ridiculous example, one buttock has, you know, 80% of the fat grafted and survived, and the other 40%. You're going to be left with asymmetry once everything recovers. So that's something to bear in mind. And the other is to bear in mind that actually, even in the best hands, you know, fat may not take for many reasons. One of them is just your general health, but also the asymmetries. Remember I mentioned, you know, hip dips being filled in. These things may not, you know, they may look good, but if the fat doesn't entirely take or doesn't take enough, you may still have the asymmetries and the little things that bothered you, and that if you're really unhappy, you may have to take the risk again and have the procedure again just to correct those. So it's something to really think about. And the other is, okay, the fact is that with this procedure, you know, it's lifelong. You've taken fat already from somewhere, you've put it somewhere else. If you don't like the result of it, it's not as simple as just taking it out. Sure, you can liposuction some of that excess fat. Let's say trends change, or you've just changed in your life and you don't like the effect of it. But that's an even trickier procedure to do, and when you've had an operation somewhere, it makes it harder to have a second and a third surgery, because there's always going to be an element of scar tissue left there. So that's something to bear in mind. This isn't really easily reversible either. So, you know, the other horrors that can happen, so the risks that I've mentioned are the risks that can happen when the BBL is performed correctly, the way it's supposed to be performed, in experienced hands. You can still get all of these risks. Of course, in people who are not experienced, or people who are not qualified, or in places where this procedure is not regulated, even worse things can happen. So in some cases, there have been situations where people aren't just really injecting fat, which we know at least is safe as a product itself, but they're injecting things like silicone, which is completely unacceptable. So that's something else to bear in mind, and that has caused deaths as well. And that, in that situation, even if it doesn't cause death, it will cause scarring, it will cause kind of inflammation and granuloma formation, and things that are going to need extensive surgery to treat. So please think about this. Where do we stand in terms of BBLs? Well, in the UK, the British Association of Aesthetic Plastic Surgeons has said that they don't recommend any surgeons do this procedure because of the risk of death and these really high risk of complications. This is just a guidance. This body is unable to, you know, ban the procedure. And I know a lot of surgeons have stopped doing this procedure just because, even though they know they may get good results, the risks seem really quite excessive. And that's something, as a doctor and surgeon, you often have to outweigh the risks and the benefits. And sometimes the risks aren't worth it, even if the benefit is huge. Some surgeons do provide it, and this is not to critique any of those surgeons. Everyone has to always have the responsibility as a doctor of judging their own practice, but I'm just letting you know where this landscape is. Internationally, plastic surgery organizations are keeping up with the research and looking to see, is this a procedure that should be performed at all? If it is to be performed, how do they make it safer? And it's worth keeping up to date with these developments. And then finally, are there, so maybe you're interested in a Brazilian butt lift, you're scared because of the complications, but you really want kind of to do something. Are there any alternatives? So there's some good and bad news. There are some alternatives. So one, the oldest ways of kind of butt augmentation or buttock augmentation was doing implants and surgeries that kind of that can shape the muscles a little bit and adjust them and lift it. So those are still possible to do, and they are safer than a Brazilian butt lift, but they also aren't without risks and complications in terms of possibility of chronic pain, nerve damage if you're having implants. Although implants are safe, by and large, there's always that risk that the implants contract, there's the risk that they end up being rejected, there's a risk that they get infected, there's also a risk of them kind of rupturing, so breaking, and then they'd have to be removed, and also they're not really designed for use forever. So that's something to consider, and it's always important to do your research up front, look at the recommendations by your national plastic surgery and aesthetics organisation. So in the UK, that's Bbls, and in the US, the American Society of Plastic Surgeons. So look at what their guidance and their information about these procedures are, because that is going to be evidence-based, it's going to be impartial, and it's patient-focused and safety-focused as well. And I'll leave links to these below. In terms of alternatives to surgical Brazilian butt lift, there is also the potential to have non-surgical, so dermal filler, BBLs, and like I mentioned, these are quite popular at the moment. But it's important to realise then also not without their complications and their risks. So the data is out there at the moment. They look safer, but there isn't enough. If you think there's the 20-year history of Brazilian butt lifts that we have, and we have all that data to know what the risks are, what the complications both in the short and long term are. We don't really have that data with dermal fillers. One of the reasons that I'm hesitant about this procedure, and we don't provide this procedure in our clinic, is just that you are still injecting a product. Even if it's a safe dermal filler, it's one that is very biocompatible, you're still injecting it into an area that's highly vascularized, and in the way that fat can accidentally get into a blood vessel and travel into the lungs and cause a pulmonary embolism, which can cause death. There is the same risk of that happening with dermal fillers when injected into that area. So it's really important to remember this when you're considering this procedure. That risk hasn't been removed, because it's not that it's the fat that is getting in there, and only fat does that. Anything you inject into that area has that theoretical risk. I hope you found this video useful. I'm sorry it's a little bit long, but I think it's really important to discuss some of these procedures that are being really popular. They're widely advertised, but not everyone really appreciates the risks. And I hope that this, if you are considering this procedure, this inspires you to just at least hold off and do a little bit of background research. I'm sure you've already done some. But just to really explore. If you are going ahead, please remember, with any procedure, with this, look for a qualified, registered, experienced plastic surgeon. Please don't be too tempted by cheap packages or kind of think, if you are thinking of getting this procedure abroad, there are risks associated with that, including what if something goes wrong? Can you really be safely taken care of out there? And also it's about accountability. Plastic surgeons surgeons, for example, in the UK are subject to sets of regulations and rules that mean that people can be held accountable if there is a problem. If you have any questions or any experiences you'd like to share with us, please leave a comment below. If you like this video, give it a thumbs up, and if you haven't already subscribed to our channel, please do so. Until next time, see you.